Good morning. My name is Charles Coe, and I am the Clinical Director of Nursing of the Med-Surg units at St. Joseph Health Center in St. Charles, Missouri. I want to say a special thank you to Gasper for allowing me to speak today about my passion, which is patient experience and patient engagement. I've been a nurse for almost 30 years, and during that time, I've seen a great deal of change. Some good, some bad, and some just ugly. But if we take a 10,000-foot view of what we do as clinicians and nurses, we can see that only really the names have changed. In the 80s, we didn't speak of patient or customer satisfaction and patient experience. We did talk about quality improvement and environment of care. One major change is that today we are truly a customer service industry. I would like to share a story with you that drove this point home to me. I'll call our patient Andy to protect the innocent. Andy's phone call is one that I will not soon forget, particularly as it came just 2 weeks after starting at SSM about 15 months ago. Andy introduced himself to me and stated that he had been on our orthopedic unit following the surgery on his knee. He stated that he had put his surgery off for just as long as possible because he didn't want to be dependent on anyone. As he spoke, his voice began to crack, and I could hear and feel tears. Andy explained that this call was very hard for him, but he wanted me to know that his stay was just less than desirable. He stated that the staff didn't seem to care about him, his family, nor his pain. Staff seemed annoyed by his request, and they were not prompt in responding to his needs. This experience had led him to lose faith in healthcare, St. Joe's, and even SSM. My heart broke. I told Andy that I was very grateful for him having the courage to phone and that his concerns would be followed on. I told him that I never wanted another person to feel this way. After we chatted, he thanked me for listening and my empathy. In problem-solving the issue, it became clear that I needed to find out from frontline staff where our failure had occurred. So I began my work. Over the next couple of months, I interviewed staff and ancillary workers on our department. The overall theme discovered was a failure in our relationship-based care model. The staff perception of RBC was, you must do these tasks, which are like bedside report, hourly rounding, completing the whiteboards, and that was the problem. RBC is not about task. It is about putting the patient in the center, which means we do with the patient and everything that revolves around the patient, and it's all about relationships with that patient and the caregiver. In analyzing these results, it became obvious that many of the staff were not equipped to develop face-to-face relationships. They had not been socialized in this manner. They knew how to form relationships with our smartphone. So we went back to the basics, and we created an educational program entitled just that, Back to the Basics. We started over. We explained to the staff the reasons why we do RBC, and then focused on how to create relationships and a positive patient experience. The education focused on skills labs where employees had to complete patient interactions simulating a bedside report and hourly rounding. Next, employees had to complete witness competencies assessments with live patients for 10 occurrences. Within 6 weeks, our overall HCAHPS rating of 9 to 10 had improved dramatically when looked at it by the discharge date, from the 30th percentile to the 90th percentile. About 3 months after our rollout of the training, I received a phone call from Andy. With great trepidation, he explained he had returned to St. Joe's to have his other knee fixed. He said to me, "I don't know what you've done, but I cannot believe it's the same unit, not even the same hospital. The care was excellent, exceptional. The staff seemed to anticipate my needs, and I didn't have to use my call light the entire time I was there. They seemed to care about me. It was unbelievable." His excitement was palpable to me. I feel Andy's story speaks for itself. We can impact patients, we can imagine a new reality, and we can change our reality, but we cannot overlook the importance of understanding our staff's perception and explaining to them the reasons behind processes and expectations. We have to set expectations clearly and hold them accountable. And these processes sound so easy, but they can be the most difficult we can ever do. However, as we see from Andy's story, they are also very worthwhile.